Well, welcome friends to our webinar today. We are very honored to be hosting this webinar for nearly 1,000 attendees from really all over the world, primarily in the United States, but we want to welcome our friends in Europe and others around the world that are joining us as well. My name is Gwinn. I'm the president of Alliance for Hope International, and we're very honored to be able to share information and we hope inspiration, and ultimately our wish is that there would be hope in this for all of us. I'm very honored to have Gael Strack, our CEO, joining us as well. As we are just beginning, you can see on the screen information that you may need if you're on the Zoom platform. You are able to go ahead and enter in the chat box, or there's also a Q&A feature on the Zoom that you'll be able to use during this webinar. Everybody is muted because we have 1,000 attendees. So everyone is muted, and the video has been turned off for everyone as well because we don't have the ability to host 1,000 people on video on this webinar. But throughout the webinar, you can certainly use the question and answer block to provide comments or questions to us, and we'll do our best to answer those or have dialogue on that as well. And the chat box is available for you throughout the webinar. The webinar is being recorded by Alliance for Hope International and will be made available to anyone that is interested in it. We will post it on our website here within probably 24 hours. So welcome, it's great to have you with us. Gail, thanks for joining me today.
It's good to be here. And I'm also very excited. I woke up, actually I set my alarm about 5 o'clock and I woke up before that. And I just wanted to say thank you for joining us today. I'm very excited. I realize I missed you. I miss everyone. And as I've been reflecting about this particular webinar and the meaning of it, I would agree with what Casey shared, but it's also about us being together, sticking together, and trying to create a community for survivors. I was sharing with our team this morning that I also feel a tremendous amount of gratitude and realizing that what it feels like to be isolated. And I think feeling that level of isolation is a good feeling, in the sense of it reminds me and it makes me think of survivors right now and what they need from us.
Well, thanks so much, Gail. And as many more of you are joining, you will find that we have muted your ability to raise a hand and speak, and we've muted your ability to use your video. So video is blocked, but you can use the question and answer box and the chat feature during this webinar. Because of the number of attendees, 1,000 people, we were unable to have folks be able to show their video or to be able to talk or speak. But please use the chat feature if you want to communicate with those hosting it. We're joined by Riley Shore and Rayanne Passantino and Kayla Halsey on our team, along with Fernanda, who's helping us as well. So they're available to you during this webinar. As we get started today, just wanted to start here. We believe at the end of the day, this is all about hope. This is all about how we navigate through this journey, how we create hope for people that we're trying to help, how we preserve it in our own lives, and how we help other people find it. Mother Teresa, before she died, was asked what the calling of humanity was, and Mother Teresa said, "We must give hope, always hope." And we believe that's our calling today. We believe that's our calling in the days and months to come as we go through this pandemic journey. And to be sure, there is fear, there is struggle, there are challenges, there's pain, and there's loss. But we believe the ultimate calling needs to be remembered through all this. Most of you that know us know that whenever Gail and I do a webinar, we always like to honor and give a shout out to our team at Alliance for Hope International, because it's not about us, it's about a team. It's about a group of people who have bound their lives together in order to encourage each other, support each other, do the work together of trying to help people dealing with sexual and domestic violence and child abuse and elder abuse and human trafficking and other forms of trauma. We always talk about focusing in our work at Alliance for Hope on people exposed to trauma. And now we're talking about everyone, because everyone's been exposed to trauma now. A pandemic traumatizes everyone in the culture. And so as we go forward today, we just wanted to recognize our team and give special thanks to them doing the work day in and day out, all working remotely for the most part now, some needing to come into the office for some of the direct services work that we do and be at agencies, but for the most part, being remote during this time. For those of you that aren't familiar with Alliance for Hope International, we have 5 major programs. Each of those programs is kind of identified there. Our Family Justice Center Alliance is the program we're talking about today, with our focus on the work going on in family justice centers, primarily focused in the United States, though we're going to talk a little bit about other things happening around the world as well. Our Camp Hope America program is the largest camping program in the country for children impacted by domestic violence. We anticipate being in 25 states this summer. What camp will look like in camps across America, we don't know yet, but we'll be studying that and evaluating it almost on a daily basis between now and summertime. And then our Training Institute on Strangulation Prevention is another very large program. Our Voices program is a survivors network across America of survivors of sexual and domestic violence that support us and advise us and support family justice centers locally. The Training Institute, as I just touched on, is really a program that focuses on near and non-fatal strangulation assaults. And that'll be relevant today as we talk. The most dangerous men in the world strangle women, and those men are still there in a pandemic, and in fact, they're at home with their partners. So we're going to spend a little time there as well. Most of you know that we did have our conference scheduled in May. That conference has now been postponed to September. We intend to go forward in September, and if we can't go forward literally and in person, we will go forward virtually. We are working on building a platform as we speak, and we will host that conference, the 20th Annual International Family Justice Center Conference, in September, either in your living room or in your study or in San Diego. Time will tell, but we are determined to keep setting goals in all of this and to keep pursuing pathways so that we get information out, we encourage and support each other, and stick together. I also want to mention, we just released this week a children's book on hope, which couldn't be more timely. It's part of our Camp Hope America program. It's a great little lullaby book for kids about how to find hope in life. Those of you that are part of Camp Hope know that every night at camp, we challenge kids at the campfire to answer the question, where did you see hope today? And then at the end of our campfires, we sing a song written by my daughter, Carrie Ann Johansson. And Carrie Ann's song is the closeout of the book. Kids can learn the Good Night song from Camp Hope anywhere in America, and they can learn to sing it. We have found Camp Hope kids are singing it now as a comfort because they memorize it at camp. So that book is available. You can go to Camp Hope America /Good Night Moonbright, or it's also available on Amazon. I want to ask Gail to get us started substantively. We've been doing a lot of reflection. There's a lot of reflection that happens in this journey for all of us as we look back and look forward. So I want to ask Gail to start this webinar substantively with this focus on where we were at the very beginning of our journey.
Thank you, Casey. And I do think this is a great place to start. Some of you have heard this story, but many of you have not. But I think starting from where co-location started is a good place. And what you see here is a copy of our very first brochure that was actually paid for by my brother. You got to get the family involved. But back in the late 1900s, when I joined Casey and the domestic violence unit, we were figuring out how to prosecute cases with or without the victim's participation. And one theme that came up over and over again, whether it was after a conviction or a disposition or at a hearing, anytime essentially we all talked to survivors, they kept saying, now what? Now what's going to happen? Now where do I go? Who do I call? And at that time, we were isolated. We were just the domestic violence unit as prosecutors. We knew that there were professionals out there who could provide help and hope and healing. But quite frankly, at the beginning, we didn't know who they were. And I remember one day just kind of like frustrated. We need to do something. We need to come up with a solution. And then I said, you know, what victims need is a brochure. If they only had a brochure with all the names and numbers, this issue of domestic violence will be solved. And of course, that was very naive of me. But one thing it led to was a realization that it wasn't easy. It wasn't easy to find those people, those organizations, those phone numbers. And no sooner did we put that together than people would change, new phone numbers, new area codes. And it was quite daunting. And the other thing we decided to do is to just jump in the car and figure out where everybody is. And that opened up my eyes. And so that was the beginning of brochures and referrals. And then that also led to, we really need to be all together. And that's when Casey came up with the idea, but you have to dream big and then of course start small. So the brochure was step one, and then co-location of 5 different agencies at the city attorney's office was 2. And then of course we went to step 3, which is starting to dream about the San Diego Family Justice Center, but it took us a long time to get there. But we were practicing co-location. We were trying to practice being a virtual family justice center with our off-site partners. And then of course, as it started to grow, I think Casey, you want to go to the next slide. Fast forward now, once we were able to open up the San Diego Family Justice Center and co-locate 25 partners in one location, then this model was featured on Oprah, and then that led to the President's Family Justice Center initiative, which then of course led to us helping other communities. And what you see here is an advocate who had that dream to start a family justice center, Annie Dowling from New Hampshire. And we were sitting with her one day in her office, and she asked the question, well, who should I invite to strategic planning? And Casey and I kind of looked at each other, looked at the wall, looked at all these brochures and laughed out loud. And what we were laughing about was our journey and also seeing the best brochure rack in the whole wide world. And it became very clear very quickly that you need to invite everybody who has a brochure on your wall to strategic planning. And from there, we realized, and it was actually, I don't know if you remember this, Casey, the first time we started to talk about virtual family justice center, because they were so excited about starting their center that they wanted to do it now, all virtually. But one of the things we discovered is that the virtual family justice center concept was ahead of its time, that people still needed to kind of learn how to work together, live together, collaborate. And then even after you co-locate is how do you integrate? So that is a good reminder. Fast forward yet again to a focus group that we did in Colorado that will always, always stick with me. It's amazing how certain things stick with you and they're in your heart and never leave you. We were doing a focus group with survivors in Colorado, and we were asking them how their system works now and how would you like it to work in the future? And this topic of a brochure came up. And one survivor said, the brochure is nice, we like the brochure, but we, in a time of crisis, in a time of trauma, we don't need the brochure. We need you to be the brochure. And that landed, and it also was something that Casey and I wanted to talk to you about now, because right now our survivors are not only in a time of crisis and trauma, but even more isolation. And also you add that and layer that with fear and the unknown. This is our time to rethink about virtual family justice centers. How do we provide services in a very creative way? And we're excited to be able to share a lot with you today, because family justice centers, thank you very much. You have stepped up to the plate. And we know that other domestic violence programs have done that as well. But today we are focused on what family justice centers can do. So another theme that has come up as we've been helping communities think about family justice centers, sometimes we end up being focused on a family justice center being a building, and only in that building you can provide services to survivors. But this time right now is challenging us to think outside of that building and realize that it's not the building. It's those relationships, those partnerships on-site and off-site, and then coming up with, as I mentioned, creative ways to stay connected with survivors. And we've had a number of conversations with directors and survivors in the last couple of weeks that we will be sharing with you. So I think this is definitely about being there, and no matter how we connect with survivors, then I think the other challenge is being fully present for survivors as we're all dealing with this issue in one way or another. So Casey?
So as we begin to kind of dive deeper here, I just want to make a kind of framing comment. We've got to cast a vision for our organizations, for our allied agencies. We can't just say we've got to just hunker down and survive this thing. Not just days ago, in a state that went into a lockdown, I watched the governor literally say in a live press conference, it's time now to just hunker down. Now, we'll talk about the importance of the science of COVID-19 and why staying at home, if it's safe for you to do, is the right thing, and how we can protect people. But we have to make sure that in that journey of trying to protect ourselves and those we love, that we're still casting a vision. You can see my quote on the screen. Some leaders in this crisis are saying we just need to hunker down, but our real calling still has to be cast a vision, have a plan, pursue it, let people share in that vision, let people share in that plan, because hunker down is not a vision statement. And that is not the best we have to offer as leaders in this movement as we go forward. I believe the message has to be even stronger than that. We are creating some artwork that we are going to make available to any family justice center, to any agency in America that wants to use it, that says hope is greater than fear. We can provide it to you in this format with or without our logo. And we actually are creating a pop-up for our home pages on all of our websites that will be clickable. And you could, again, have your own logo on that. This is the kind of messaging that survivors should see when they go to your websites, when they go online. It shouldn't just be COVID-19 alert or, hey, here's information about COVID-19. At the beginning of providing that information, survivors need to know that hope is greater than fear, and that your community, your victim advocates, your agency, your first responders, they are the people that are going to be offering hope. And so Yesenia Seavies, who's a very gifted graphic artist on our team, has created these banners, and we're more than happy to make them available to anyone. You can email us at info@allianceforhope.com. Tell us if you want your logo on it or if you want no logo on it, and we will send you a high-resolution version of these logos. The science of COVID-19, which we're going to start with, certainly is incredibly important. We've all heard it. We've all seen it, and we're all living it. I think many of us thought in February that we could avoid this, that we could somehow get around it. Obviously, we're not going to get around it. Now we have to go through it as a country and as a globe. The entire world is going through it, not around it. So we strongly encourage folks, if you are not a first responder, if you're not a frontline worker, stay at home. If you have symptoms of any kind, quarantine yourself. Call your healthcare provider, seek direction. We've learned the lessons about cleaning surfaces with public contact constantly, about hand washing. We just donated some products here where I am in Idaho to our local shelter. When we called and asked what they needed, they said they need toilet paper and cleaning supplies. Those are the primary things because they're cleaning constantly inside the shelter. So we know that's true in family justice centers and other agencies as well. We also know this incredible importance of hand washing. So we know that science piece for sure. But the more complicated emotional part of this is we're in a war with an invisible enemy when we talk about COVID-19. Can't see the germs, can't see where they are. We don't know how long they last on packages, maybe hours, maybe days. We don't know how long they last on hard surfaces for sure. So as we go through this journey in a war, a global war with an enemy that we cannot see, I just wanted to, right from the beginning, to honor the scientists and doctors and nurses and first responders and frontline workers that are fighting that invisible war for us in many fronts. I also want to talk about a conversation I had with some of the docs at Sharp Hospital. Joe Belezzo is the head of the emergency department at Sharp Hospital in San Diego, and one of his doctors made this quote the other day, which I thought was incredibly sobering. Our only hope now is social distancing, isolation, testing, and quarantine. That's our only hope. Well, that is not our only hope, but for a doctor, for a nurse, that is their only hope. They expect us to do those things. They expect us to do what's necessary to save other people's lives. And I told Joe, it's hard because I'm not on the front line every day. And so I feel guilty to some extent There's kind of a gap between what he's dealing with and what others that aren't dealing with that. And he said to me, Casey, do not feel guilty for sheltering in place. Do not feel guilty for quarantining yourself if you have symptoms. He said, my wife and children will thank you for saving my life if you do that. You're saving the lives of others by doing that. So I think it's an important place to start as we talk more about Family Justice Center work. And I also, whatever your faith tradition, whatever your background, I just want to say, pray for first responders and frontline workers everywhere. This is a picture of Emily Fawcett. Emily Fawcett is a nurse in New York City. She's in Manhattan at Lenox Hill Acute Care Center. And some of you saw the blog post that I did recently where I honored Emily. She created something called Hope Huddles every day at the hospital as they're dealing with their patients who have been intubated, patients on respirators, patients in critical condition. And she realized that first responders needed hope more than ever. And so she created Hope Huddles. You can look up Hope Huddles on YouTube and see the video. You can go to our website and see the blog post with the link to it. But we need to keep them in our thoughts and prayers in every way possible. There's the YouTube link, and if you access this later, you can have access to this PowerPoint. But that's the work of first responders. I think every organization in America should be having Hope Huddles every day right now. We're doing it at the Alliance. We're doing it virtually, online, on a Zoom platform, but I think we should all be doing it. And I think we should all be doing everything we can to thank and appreciate first responders and frontline workers, not get in their way, not endanger ourselves and therefore endanger them, but do everything we can to be kind and loving to them, because they are on the front lines of something none of us have ever seen, certainly scope-wise, in our lifetime. I also want to recognize that people are dying in this journey. Thousands are dying. 160 New Jersey police officers have already tested positive. We're seeing those results come in from all over the country, hundreds and hundreds of police officers testing positive. And NYPD's had at least 5 deaths so far, officers that have died because of COVID-19. And that's going to continue. We can't prevent all deaths. We can't prevent first responders from being exposed, but we certainly want to recognize it. I also wanted to recognize and honor Santa Rosa Detective Mary Lou Armour. She worked in our field in sexual assault and domestic violence. She's the first California officer to die of COVID-19, and I wanted to take a moment and recognize her. I also wanted to acknowledge that there are others who are passing away during this journey, not of COVID-19, but that are passing away. Annabella Escobar was the director of the Manhattan Family Justice Center. Annabella passed away on March 17th. She's one of those thousands that don't get to have memorial services with all their family members gathering. She died after a significant illness and a fight for her life, but first Family Justice Center director in this journey to pass away. And we wanted to recognize her. If you look her up on the New York City Family Justice Center's website, you'll see an amazing tribute to her life, her zealous passion as an advocate, the work she did to end gender-based violence, and her passion for helping others. But in the journey of acknowledging first responders and frontline workers and the invisible enemy, the invisible war that we're fighting, let's not forget the enemies that we can see in this journey, because the enemies we can see are the powerful things that we're all focused on in our day-to-day work today. Gail?
Thank you, Casey. That was important to acknowledge our losses. But it's also about trying to identify some solutions as well. A couple of comments I want to make because I've been watching the chat. First, I just want to say thank you to everyone who is typing your comments in. It really is touching my heart and touching everybody else's too. And we have a whole team of folks that are answering some of your questions right now in the chat. And then, of course, we're going to go to the Q&A afterwards. But one of the things that we wanted to kind of like recognize and put our arms around is what is happening out there. As many of you know, I've been doing some Google alerts and really tracking what's happening in the accountability and prosecution, and also when it comes to bail. And with all this bail and jail reform, a lot of things have been happening. We have been seeing this before the virus hit us all across the United States and around the world, but even more so. So for those of you who are at a family justice center or not in a family justice center, we are seeing that arrests are being avoided, and you can understand why. We've got too many people in the jail. There's a risk there of coronavirus, and how can you mitigate and contain that? We're also seeing that in the grand scheme of things, with courts being closed, prosecutors being stretched to capacity, trying to figure out ways how to handle court from a distance, that the misdemeanors are going to be deprioritized and put on a very low level. And as many of us know in this field, when it comes to domestic violence misdemeanors, those are the ones I worried about, because it can only take a matter of seconds from a misdemeanor going to a felony, going to a homicide. And it was happening before, and it's happening even more now. Domestic violence offenders, stranglers, they're bonding out. They're returning right back to the home sooner than even an officer can finish their shift. So we are dealing with a lot of issues, and accountability and maintaining victim safety is at the top of the list.
We're also seeing and hearing from many of you that there's an enormous challenge in housing for survivors that want to leave quarantine and need to get away from an abuser. We know that shelters are struggling with capacity. We'll talk a little bit later about hotel rooms being used. A hotel room or a motel room doesn't create community for a survivor, but it certainly can create distance and safety. And we're seeing literally thousands of rooms being used. I just saw that the French government just announced that they're going to pay for 20,000 motel rooms for domestic violence survivors to be provided housing for free. This is a huge need. We've got to raise this issue. Motels and hotels are sitting vacant across America, so reaching out to them in your local community certainly is significant for survivors. Don't forget children too. The children are also in that home. And we talk so much about adult survivors of domestic violence. We're going to talk quite a bit about children today, our Camp Hope programs, and how some of our programs are reaching out to their kids and letting kids create their own safe communication mechanisms with people, so that kids have a relationship and have things to look forward to. We are seeing that some centers are really striving to continue some on-site services, especially in severe emergency situations. And we think that's important. When you're talking about somebody in a life and death, near fatal strangulation situation, a violent sexual assault, the use of guns, we know those lethality markers. I do think we have to do everything we can to provide crisis intervention services for them in some form, and not just say, call 911, call 911. I also think that we need to start being experts quickly in unemployment benefits. I just read the CARES Act materials yesterday, and I'm going deeper and deeper in those. We all should. We're seeing some centers that are getting their advocates up to speed on the stimulus funds, on unemployment, how to apply for unemployment. All of that should be part of what we're doing in centers, because survivors need that as much as anybody else needs it. We have tracked the lockdown and stay-at-home orders. I'm very happy that Florida finally imposed a lockdown order. I don't know why it took so long and why other states are still dragging their feet on this. Most states have gone to a stay home or stay in place order. But we are pleased that not all of the orders, but a fair number of the orders have made very clear, and this is our messaging: survivors are not under that stay-at-home order if they're not safe. If a survivor of domestic violence needs to get out of a quarantine situation for safety and escape, we've got to get that message out to survivors, because perpetrators will cause them to think you have to stay home. You'll get arrested if you don't stay home. You'll be in trouble if you don't stay home. Survivors need to know that most states have addressed this and have said survivors do not have to stay home if they need to go to a safe place. And we need to obviously raise that awareness and make sure they know about it. Family Justice Center directors have had a couple of calls with us. We did a survey, put out 2 survey requests for information. And we are seeing that because family justice centers are essential services, public health, public safety, we are seeing an effort to try to provide some direct services in centers at some level. We're seeing a lot of virtual work, obviously, but we also want to keep highlighting this notion of emergency services in person in protective ways, even without being in the same room, but being in the same building, perhaps, we're seeing around the country for those that are in the greatest crisis. We just can't simply say, here's your referral list, call this number, call that number. So those two things we've heard from Family Justice Center directors. Gail?
Yes, and we're also very excited to see how many law enforcement officers are still working out of most of the family justice centers. So we'll just say, good for you. Thank you again. We can't thank our frontline workers enough here, but having a face, a person to talk to, a smiling face, a caring face, a compassionate face and voice is definitely the key. And we've also been able to see a lot of creativity. It's an interesting thing. I will share just a little bit more here. We've been working on a technology project to try to have a new intake system. And there has been some pushback and resistance. And I'm trying to constantly find a gift when something goes wrong. And I think there will be a gift here as we go through, as Casey said, this coronavirus crisis. And I think one thing that has happened overnight is the embracement of technology, and how technology is the lifeline right now to survivors to try to feel connected in some way. So thank you to all the family justice centers and others who have gone to Skype, to FaceTime, to Zoom. There's all kinds of now programs out there. I'm still learning. I'm embracing technology even more than in the past. But one of the things we even talked about is in our safety plan, which we're going to talk about later, what other creative ways can we find for survivors as part of their plan to maybe go to a library if, well, library is not open now, but we haven't come up with all the solutions, but can there be a safe place for survivors to go where they can, on their own, initiate that contact with a family justice center, an advocate, a therapist, somebody that they feel that they need to talk to? And I am seeing some teletherapy and folks that you can talk to. So thank you for those who are doing that.
Some of you on the calls have talked about the need for compliance with valid confidentiality provisions, which is a very important piece as we move to electronic platforms in family justice centers and virtual family justice center approaches and services. We have looked at the DocuSign platform. We've looked at a couple others. Most of the centers that have gone to electronic signing are using eversign.com, which can allow a survivor to access, if they have access to email, it allows them to be able to authorize the sharing of certain information, specific information through eversign. It's very inexpensive compared to other platforms that we looked at. I know some of you are using that. We think that's a good approach at the present time. We are also seeing that a lot of centers, including shelters and community-based agencies, are developing code word systems with survivors, so that if survivors have to be back home at times with their abuser or in their abuser's presence, that they have the ability to use a code word when they need help. I just saw that in France, in the Paris community initially, and now across all of France and Spain, they've started using code words for survivors in pharmacies and drugstores, so that if a survivor is going to get a prescription filled, if she says mask 19, that's the code word for my abuser, I'm in danger and I need police now. They just made an arrest yesterday in Paris. And that approach, I think, is a good one to come up with ways that survivors can be able to tell you when it's safe for them, when it's not safe for them, and when they need help, even if they're not able to say it directly. Certainly now with victims being home more with their partners. We are hearing about PSAs being made and videos. I've watched some that are really bad, and I've watched some that are really good. Make it be inspiring. Don't just put a talking head in a camera. Make sure that if you're sending a message out on your website or making a video, make it be something that's encouraging and supportive to survivors. I saw a good one made out of Faces of Hope in Boise, Idaho, that they just put up on their website for survivors. Very powerful. We've seen some others around the country. Use real faces and real voices in those. People need to see real people and real faces and real voices when they hear about the services that are still available. And Gail, I know we're seeing a lot about this movement toward electronic filing, video connections to courts. We'll talk more about that later, but I just wanted you to talk about it now because we're hearing of so many centers moving this direction.
Yes, and thank you. I lived and breathed this one. As many of you know, when we opened up the San Diego Family Justice Center in 2002, we saw 87 clients our first month, and it quickly started to double, double, and double. And we also overwhelmed the court because victims were getting more restraining orders. Initially, the court and our presiding judge, who was a good friend of ours, was very resistant to that. And then when he started to see the numbers and he started to see the conflict that was happening in the courtroom, he gave us a call and said, you know, I want to talk about that electronic filing idea that your team had. And we were able to have a pilot project because I discovered a great way to start some things sometimes is a pilot project. And that pilot project actually went on for 10 years and then it stopped. But I'm hoping that the discussions that all of you are having now can come up again, because this is the time. And I'm looking at the chat feature, and many of you are writing that you have been successful in getting electronic filings for protection orders, video cameras going. So good for you. We're going to be talking about technology a number of times because this is our opportunity to continue to advocate for it, and the courts are going to be open for it. So we'll come back to this even in more detail. But so this could be a gift, an opportunity for us to really advocate for survivors that we've been having a very difficult time over the years. So thanks.
I also wanted to kind of give a shout out and a thank you to Dorchen Leithold in New York City, who's a dear friend who runs the legal program at Sanctuary for Families. And just put this out as a call to all of you. Be willing to demand help and support for survivors. Dorchen just had to go public talking about the need for access to court services for victims of domestic violence. Don't be shy to reach out to your presiding judge. Don't be shy to make requests of courts. We've got this huge issue about child exchange now going on between perpetrators and victims. Don't be shy to reach out to your presiding judge and talk about a special order. Don't be shy to reach out to the Chief Justice of your Supreme Court to talk about a special order to make clear that survivors don't have to put themselves in jeopardy physically, in jeopardy, medically in jeopardy, because there's an exchange order, or if a perpetrator is using that to manipulate or expose her to COVID-19. We've got to advocate aggressively. You can't just assume that nothing can change, because Dorchen got attention from the courts in New York City just this last week. And I think many of you are starting to realize we've got to make the requests. And if you need a special order, if you need the governor to pay attention to this, let's be advocacy oriented. The other big issue that Gail and I are incredibly concerned about is we are tracking the rise of domestic violence murders, murder-suicides. Gail, I'd like you to just talk about that. It is something that we've got to be on red alert about with high-risk situations.
Definitely. I do want to take this opportunity to talk about one other thing that I'm seeing in the chat feature that's going to be really important. Everything that we're talking about right now will be made available to all of you as we wrap everything up and send you a link to our Dropbox. The other thing that I'm realizing as we are identifying courts across America where presiding judges are making these orders to really enhance victim safety is that I'm going to have our team help me do this, but come up with a list of all the judges that are doing it. And that might be a way to help you and your community when you know how many others have quickly responded. Coming back to this particular issue, as we were putting our arms around all the things that are happening or could be happening, we were very concerned about the rise of domestic violence homicides. We're also very concerned about murder suicides as well. And as we were doing our Google alerts, and Casey's alert is specific for murder suicides, you can see a couple of things here. On March 29th, he identified 7. On March 31st, he identified 9 murder suicides. These are all domestic violence incidents.
In one day.
And yes, in one day. It's heartbreaking to just conceive all of that. And we would love to kind of identify each one, but because of time, we're just going to pick out a couple. When I did my Google alert on domestic violence, this one came out. It was one of my first ones on March 28th. And it really did represent some of that tension, pressure, and what is going on in homes. It involves a batterer who was at home with his 3 teenage children who are also at home at this time. As you can imagine, as tension was mounting, as he was drinking, as he was handling the gun, the children were getting very concerned for their safety. And one teenager reached out and called 911 to get someone to help them. But it was already too late. All it did was escalate the situation. And by the time the officers responded, 2 teenagers were dead and he committed suicide. His teenage daughter was able to jump out the window and escape. But what impressed me too is how this officer, one of the domestic violence lieutenants there, really made a plea and took that opportunity to let other people know about the resources that are available, that as tension mounts, there are people to talk to. And that's one message that needs to be shared over and over and over again. So going to the next one, as many of you know, we also track the connection between domestic violence, strangulation, and cop killers. And we did suffer one of our first police officers who was killed in the line of duty responding to a domestic call. It happened to be a call among roommates where tension was building, and the roommates were concerned about how things could escalate. And later we found out that he had a history of domestic violence. But as police officers were going to the scene, trying to address the situation, everything at first was quite calm, but quickly escalated. And Commander Greg Carnicle was shot and killed, and 2 other officers were shot. And from all reports, they're doing well and they will recover. But it is a reminder about what is happening now in the community.
Greg was just months from retiring, and so we wanted to remember him and to let you know of it and to keep his family in your prayers.
I also wanted to talk about risk assessment and safety planning. Many of you on this call, you're experts at risk assessment and you know about all the risk assessment tools, but we also know that people are joining us today could be new to this field. So this is a time now to embrace new things. As many of you know, there are a number of risk assessment tools. Jackie Campbell Danger Assessment Tool is one with 20 questions, 11 questions, and 5. A Mosaic method is also very top on the list, especially when it comes to stalking. Odera is another tool. We have other tools that really focus on offenders. And then, of course, there is a safety plan that we've been playing with. And we wanted to share this with you. Actually, one of my law students found it as we were exploring safety plans. This is the only safety plan that I've ever seen that really focuses on kind of like the science of hope. It doesn't say the science of hope, but it is about the science of hope, about goals and options and risks. So we wanted to share that with you. We also wanted to let you know that Dr. Chan Hellman will be spending time with us in May, maybe now remotely, virtually, and every kind of online method. But one of the things we will be playing with, thinking about, and working with survivors on is how can we take this particular safety plan and also customize it with even more of the science of hope, and now coming up with new and creative ways to stay safe during this crisis. So we wanted to share that with you, but I want to highlight one more thing when it comes to Dr. Jackie Campbell. Many of you, and maybe you haven't used the LAP model, which is the DA-11 for police officers. Strangulation has always been like below the top 5 questions. There's a lot of discussion now about getting strangulation above the fold. And just talking to Dr. Jackie Campbell, she says that is in the works, and people keep asking this question, and we just want you to know that we're staying on top of it, and hopefully changes will happen very soon, and we'll keep you posted.
So we want to run around the country a little bit, in the United States at least, and talk about what family justice centers are doing, give you some ideas. I know we're all struggling to be creative and to try to figure out what new ways of providing services and creating a culture of hope for survivors should look like when we can't always be in the same place with them, especially in these weeks and months to come. Right off the top, we are seeing that sites are immediately changing their websites to make sure that when their websites get hits, that it's very clear what's available and what's not available. This slide from the Alameda County Family Justice Center went up very early on in the crisis, and it's a good example. I just saw that in Australia, the search hits on Google for domestic violence help has gone up 75% in Australia. So thinking about where you register in a Google search, whether you're visible, and what they see when they come to your website in a community is a really important piece. In Erie County, Buffalo, Mary Murphy, the director there, they put up a special notice on their website that's a pop-up that I do think is important because it immediately says that they're having to provide services by appointment only in certain situations, but they can't take walk-ins. So all of this, but they are doing things on chat box and electronically. So survivors need to know quickly when they get to your sites what is available and what is not available. What I really was excited about and encouraged by is Mary said, we're also using Hope Rising to encourage people, survivors, clients, staff members, partner agencies. We're just giving out copies of our book on the science of hope. We just donated copies to a jail in Oklahoma so that women in prison and jail could read Hope Rising, and we've gotten some amazing comments from them. Make sure that we're accessing, it doesn't have to be Hope Rising, but make sure that you're offering the tangible things for people to understand the science of how to maintain a future orientation in this, even in the midst of crisis. What are our goals? What are our pathways in all of this? One place, FJC in Birmingham, Allison Deering went out with a public press release very early on. We think that should be happening. You should be regularly doing press releases from your programs and saying, hope is still here. Hope is still here. This is what we have available. This is how we can offer help during the quarantine. Survivors don't have to stay in quarantine if they're not safe, and if they're experiencing abuse or they're fearful for their lives or the lives of their children. That messaging has to go out. We've been interacting with Diane Lance and her whole team at the Nashville Family Safety Center as well in this. I know Diane is is in our chat room. If you look at her comment, she was talking about early on the realization that there doesn't actually have to be an in-person hearing for a restraining order. It's with both sides present. It's not required. Initial restraining orders are always ex parte. They don't have to have the other side, no notice, and they don't even have to be in person. There's no requirement of that. It's just local court rules. In most places, you can change that. They can be done electronically. They can be done from kiosks like in Tacoma. There's lots of ways. We'll talk a little bit more about that. But Diane and her team are working on an outreach campaign for reaching out to prior clients of the Nashville Family Safety Center and their allied agencies. And they're working on a script for that. This would be like the equivalent of a public welfare check or a public safety check. And they're providing their services, remote, video, telephonic. Nashville PD is still there, but they're working on creating a script for that. And Diane has agreed to share that script when it's done. So if you're interested in how they're going to train people to make essentially cold calls to former clients to check on their safety, you can email us at info@allianceforhope.com, and we will provide that when Diane has it ready to go. Contra Costa County, I love what they did on their website. They went up and said, we're on Zoom immediately right now. Here's the phone number you can call. And then when the survivors call, there's a real person that they get to talk to, and then they get a Zoom link that they can access if they have access to a computer. Contra Costa also has a training program for all their allied agencies, and they've shifted that quickly to Zoom. And I love the fact that Susan Kim has been really focused on how to raise immediate money for grocery cards and gas cards and go after grant funds for those purposes. The public awareness campaign in Stockton, I just love the fact that the core agencies in the Family Justice Center, including the police department, just put out social media posts of real people with real faces, with real logos of their agencies saying, we're still here, we're still open, we're still available for you.
Sojourner. Image of we, the power of we, Casey.
Yeah, the power of we. Sojourner Family Peace Center, this is their homepage on their website. I love the fact that it's not just a blast of COVID-19. You can see COVID-19 and domestic violence and a message from Carmen Petrie and her allied agencies over on the left. But that branding is great. Sometimes home is not a safe place, even in the midst of this. And so, and I love the fact that there's real people in those pictures, real faces. So there's a humanity to it and not just like a government website with a posting. If you go to familypeacecenter.org, you can see what they're doing there. And I love their community update. It's a great model. 3 things survivors can do despite COVID-19. Go to that. I'm sure they don't mind at all. Borrow it, plagiarize, create your own page like that. It's a lot of thought from advocates about how to communicate and what to say to survivors. We love what Palomar and Kim Garrett and her allied agencies are doing in Oklahoma City. They're using live chat. A live chat is a contract program that anybody can contract with. It's a private company, so that their navigators and advocates can literally be in a live chat conversation. This is on their website. Survivors can go to their website, enroll in live chat, and talk to somebody. I also love the fact that they're coming up with ways for their teens to communicate in their teen belonging group. I love the fact that their children's navigator is doing Facebook Live videos and reading books to kids live on Facebook. These are children that are clients of their center, and now they have the ability, if they can get online, to access that. And I really like what they're doing with this Super Judy, which is a program where a children's navigator who's dubbed herself Super Judy can give advice and support to moms with their dealing with their kids and struggling. Remember, we've got traumatized people who are now further traumatized. We've got a pandemic of domestic violence that now has a pandemic of COVID-19 laid over the top of it. So anything we can do to give that kind of support, I think is really powerful. Palomar also installed a ring. I think a ring is a great idea at the front door. If the center's not going to be open, a ring lets you communicate live if a survivor still walks up to your front door. I think every family justice center should do that. I just reached out to the founder of Ring and said, you should donate these to every DV agency in America. He has not called me yet, but I'm going to keep advocating for the donation of a ring for every place in America that has people walking in for services. If we can't open the front door, we got to have a way to be able to communicate. And I also love Palomar's lending library. Some of you know they have this little free library box outside their family justice center facility. They've turned it into a food pantry where donors and supporters can come by and put in food, and survivors can come by and get food. I love that idea. Yes, some people might take advantage of it, but that's a tangible resource for survivors. And Gail, we've been giving a lot of thought and hearing from sites about the fact that in some places calls have initially gone down, and then it seems like over time calls are climbing. Do you want to talk about that?
Definitely. So this was an interesting conversation that we had. We initially thought that calls would be going up immediately, but that necessarily has not been the case. What I wanted to share is that last year I had the amazing opportunity to actually train live in person with the domestic violence advocates at the domestic violence hotline. Many of you know the hotline has been available. It's 1-799 SAFE. 1-800-799-SAFE is a number you call. But they were like always invisible to us. And so I had the chance to meet them, and they wanted to take pictures. And many of you know I put that in my PowerPoint. But one of the things I learned is that every single day they get over 1,000 calls, whether it's calls, text messages, chats. And when we ended up reaching out to April and others, we found out that their numbers didn't go up at this time. And I had a chance to talk to an advocate from Buffalo just this week, and she actually said her hotline numbers of the calls went down by 31%. So obviously we know the answer. Victims are not in a safe place to make those phone calls. However, we're also seeing increases in other areas. So we wanted to highlight a couple of things. Guilford County Family Justice Center, you know, go Catherine and the entire team. You're always thinking of ways of how to get the information out, how to support people. And a couple of things that Catherine has identified. I'm just going to move my chat feature off here. The things that they're seeing is a lack of a criminal accountability. But some of the chats are saying that the cops, the law enforcement officers are out there making arrests and doing their best to keep those courts open and hold folks accountable. Casey talked about this before, the housing and the shelter issue. And then, of course, low bonds to stranglers. I want to highlight a couple of things. Virginia is the first state in America that actually passed the law that when it comes to strangulation, there is a presumption of no bail. Virginia recognized that when it comes to stranglers, they're different. They pose a high risk to victims and to the general public. And New Jersey, I didn't have a chance to check, but their bill is also going through their legislature, and it looks like it's going to pass even at a time of bail reform and jail reform. And also, if you think about it, our elder abuse victims are also at risk if they're being arrested and being let out immediately just to go back to the same residence. But in the middle of all of those challenges, there's Catherine getting ready for another marathon and working with her co-runner. They figured out their next path, their running path, and look what they came up with. They're going to run the path of hope. So they're not giving up on hope anywhere, anytime soon. And I think that's exactly the spirit that we need right now. So in looking up and what's been happening, Guilford actually has reported that the DV calls are up by 21%. And I think when victims find that opportunity to call, they're going to call, and we've got to be ready for it. If you look at the other slide here, saw the same thing in San Antonio, the police and Bear Family Justice Center. They're together getting the information out, putting out press releases. They too saw a 21% increase in domestic violence itself in addition to the calls. But one of the things that we sort of like went, oh my gosh, this is like beautiful. They actually, just in the nick of time, were able to put out and launch their online protection order. Casey had the chance to kind of go through it in detail, and he just fell in love with it. I don't know if you wanted to share a little bit more about what you found.
You can see the website link there on the screen. I encourage you to go to it. That's the model for the nation, what the Bexar County DA's office and Family Justice Center have done for online protective orders. It's an incredible system they've set up that's integrated at the Family Justice Center under Crystal Chandler's leadership. And it's a great model for how to do filing of protection orders and electronic access to protection orders while the services of the Family Justice Center are still being provided, albeit in many situations virtually or electronically on a Zoom platform or a WebEx platform or some other platform. But we like that model for how to do online protection orders. I think it's the best one I've seen in the United States.
And I also like what North Carolina is doing. North Carolina is now almost statewide going to online protection orders, and have done a really good job in pulling that together. We wanted to share some of the things that were happening at St. Joseph County Family Justice Center. I think what pulled me into this particular article, not only did they did a really nice way of trying to do some outreach and send out some positive messaging, but I think Amy Stewart Brown, the executive director at the Family Justice Center there, I think said it really well, that this is the perfect storm for a domestic violence victim. And she also commented how batterers are using this isolation and scaring them either to kicking them out so they can get infected, or letting them know that there's nowhere to go and no place to call, and you're going to get arrested for infecting others. A lot of the same themes are coming out over and over again. So in this particular, I think, press release, she did a really good job about reminding people how to stay safe, how you can social distance yourself, and that help was available, and they're still hoping. And so it was another one of those signs, hope is still here. So Casey?
Yeah, I love the messaging too. The Family Justice Center remains open. The services are still available, just remotely, to respect those public health guidance. That's the messaging, not the Family Justice Center's closed. No, the Family Justice Center can't provide services directly. The message is we're open. We're a virtual Family Justice Center now. We're here for you. These services are available. We will do what we need to do to get you the safety you need, advocacy you need, legal support, community-based organization support. I love that approach to the messaging campaign. One Safe Place in Fort Worth is doing similar things to some of our other Camp Hope sites with a daily Facebook Live for their Camp Hope kids. They've got all the information about those kids and their parents, so they've got the ability to reach out. We like that. I really like what they're doing on their Twitter feed, how they basically have been posting messages, Michelle Morgan and her whole team, saying abusers are going to try to do this. And then they just plain list them in different tweets. I think that's a great idea because they're hearing these things from survivors. So being able to tell those messages to survivors is really important, because now survivors know it's not just them that this is happening to. The kinds of messages you see on the screen are trying to tell her that she can't see friends or family, even electronically, that she can't have any contact, even from social distancing at 6 feet, because you can be in the presence of other people like family members. You just need to keep social distancing. So perpetrators are going to do all kinds of manipulation. I love the way they're using Twitter for that purpose. I wanted to give a shout out to Margaret Abrams and the team at the Rose Andom Center. They're using a variety of platforms. Doxy is a platform, Teams is a platform, and Zoom. They're doing electronic filing of restraining orders. They've kept their forensic medical unit open to try to do exams as much as possible with healthcare professionals. They have the forensic medical unit housed in the Family Justice Center. I like the fact that for those that don't have a computer, they set up a lockbox so that survivors can fill out the paperwork that they give to them and then leave it there without having personal contact. And they've done a partnership with Lyft to get free rides. We should all be reaching out to Lyft locally for sure to ask for assistance, as many domestic violence agencies have also been getting. Wanted to give a shout out to the San Diego Family Justice Center and Yvette Lopez Cooper and the work that they've been doing. One of the things that jumped out at me, San Diego is the first place to ever do this in the country. We had early on figured out how to get free police reports for victims of domestic violence to attach to their restraining orders. And I love the fact that even though the San Diego FJC has had to go virtual, that they're still getting those reports for survivors, even though the government offices where those reports are kept are closed at the police department. The bottom line is that they're accessing them electronically to give them to victims to attach to their restraining orders. I also like the fact that their forensic medical unit is still operating, and Yvette's point was that with hospitals full, survivors are probably much rather going to want to come to the Family Justice Center medical unit than go to an emergency room for services. And so with the partnership they have with Palomar Health, has been crucial in all that. They too, like many others, are using hotel vouchers and hotel rooms because of the limited number of shelter beds. And Yvette made the point, which Gail, you've also been seeing, that we think there's a lot of pro bono out there. Lawyers are also working from home. And if you have victims who need help, you need to be reaching out to your county bar association or to local law firms and ask them for pro bono assistance in family law right now. Because most courts, even if they're not letting people walk in, are doing things electronically, and lawyers can access that. I don't know, Gail, if you want to make another comment about that, but I think the pro bono thing could be an army right now.
Well, I agree with you. As a former FJC director, there were two things that victims needed the most: counseling and civil legal services. And from the very first day when we opened up the Family Justice Center, that has been a huge challenge. How do we recruit more attorneys, more law students to this effort? And this is a time. Just like we are feeling guilty that we can't do more, there are attorneys out there who want to help. That is the gift in this crazy crisis right now. There are a lot of people who want to help, and this is our opportunity to recruit more. And many of the Family Justice Centers, for those of you who may not know, have started legal incubator programs, taking lawyers who have just recently graduated, who are trying to start their own practice, and co-locating with those attorneys at a Family Justice Center. It's a very symbiotic relationship where the Family Justice Centers are providing them with training and information and support, and the attorneys are able to use their legal skills and put it to good use. So this is a good time for that. And thank you, Yvette, for making a point of that.
We have about 10 minutes more of presentation before we're going to do a little bit of Q&A. So I'm going to speed up just a little bit, but we did want to acknowledge Claudia Grasso. Claudia is a DA in San Diego, but she's also the head of the San Diego Domestic Violence Council. I love the fact that she took this opportunity with this moment in time when everybody has to slow down somewhat, and she said, let's check and make sure that every referral that we give on our DV Council website, every phone number, every email, that they're all real, and that there's somebody answering those phones, or there's somebody, you can leave a message and somebody will get back to you. So she created initially just a Google document and took everything she could find from brochures, sent it out to all the agencies, said, please update this, and then send it back out to all of us who are part of the San Diego Domestic Violence Council. Anybody can do that with their coordinating council right now. This is a great time to figure out if all those phone numbers, somebody should take the sheet that your police officers are handing out to victims. If you're stuck at home, call every phone number on the referral sheet that police officers hand out to victims and find out if those phone numbers are even real. Most of those numbers are probably old, and figure out how to update that form. That's a great opportunity. Gail, Essex County.
Oh, Essex County. Mary, thank you for everything that you're doing. And I think you made the point about Virtual Family Justice Center really well and very early, that because you were already co-located, you already established those partnerships, you were already integrated and working together in high-risk teams and providing those services. When you had to go remotely, it was much easier to do. Really, establishing that relationships are important and a virtual family justice center can work. So I really like what she has brought to the table and what she's doing right now. And in the midst of all of this too, she even passed an FJC legislation and working on the no bail presumption. We also wanted to give a shout out to two of our friends from the European Family Justice Center Alliance, Bert Groen and Pascal Frank. As you know, they have launched their European initiative. We had a chance to talk to them, I think it was last week, and it just felt good to be together and connected and to find out their struggles. And Pascal said the same thing. They were able to switch overnight from providing on-site services to going to a virtual family justice center because of those established partnerships and that history of working together. And we also wanted to share that they recently put on their website some practical tips and guidelines for professionals in many different settings. So thank you both, Bert and Pascal, for thinking that through, putting those not only in English, you can download them in other languages. So I really love that. We wanted to share their website and where you can get those guidelines.
It's a good example. Go to their website, look at what they've done. It's a nice framework for how any family justice center anywhere in the world could have those resources available online.
There's also, this was a reminder, we did learn that there was a family justice center that just recently opened up, and they were police led, and within a very short period of time they closed. And it made really perfect sense to me. It was a heartbreak at first, but then as you process it, you go, wait a minute, they really didn't have a chance to figure out all the things you need to figure out when it comes to co-location and integration. So in a time of crisis, people are going to go back to their comfort zone, what they know well and what they can do quickly. But it is and led to this discussion about virtual family justice centers. And that's what you're going to be hearing from us as we continue to go forward. Because even though it failed early on in our work with family justice centers and trying to start them before people co-located, doesn't mean we give up on that idea. It just means the timing of it all. And this is the timing for virtual family justice centers, whether you have one or whether you don't. Because Claudia's approach was a similar one. She just helped San Diego County become a virtual family justice center county-wide by just getting that information out and reaching out to every partner and provider in San Diego.
Wanted to give a shout out to Deb Greenwood and the amazing work they're doing at the Center for Family Justice in Bridgeport, Connecticut. We could use lots of examples of the kinds of things they're doing to operate right now during COVID-19. But one of the ones I wanted to highlight was the fundraising piece. We all know that we're facing fundraising gaps, major loss of revenue. That's been true for us at the Alliance. It's certainly going to be true for community-based organizations and agencies. There is some good news in the fundraising world, because any of you that are nonprofits are potentially eligible under the CARES Act for a small business administration loan. The SBA loans that are being made available at 0.5% interest, and they're forgivable. are also available to nonprofits. So there is an avenue in the stimulus package for some of you to apply for SBA loans to cover your gap so you don't have to lay off staff as fundraising goes down. But we have to keep trying to fundraise too. And Deb had a Walk a Mile in Her Shoes event. I'm very fond of Walk a Mile in Her Shoes. I started that many years ago in San Diego with the YWCA. And they had to go virtual. They had to turn into a virtual walk. And we're going to be seeing a lot of this virtual fundraiser stuff. So if you want to see how they did it, I clicked through their registration and everything just to see it. It's a very well done approach to that. I also wanted to highlight the Montgomery County Family Justice Center, both on the fundraising side. Rosa Levy, the head of their foundation, is working really hard to keep raising money and go virtual with things. But we also talked to Tom Mannion, their director, and heard from him. And they are still using their interview rooms in Rockville, Maryland. But the advocates are not in the room. The navigators are outside the room, or the detectives. So they're keeping that social distancing and that potential vapor splash or airflow issue away. But they're welcoming survivors into really warm, soft interview rooms at their Family Justice Center, and obviously then wiping and cleaning them down constantly. But I love the fact that that center is not fully open, but it is open for survivors, because those rooms can still be clean, they can still be safe. This is essential services, and that's possible. And Gail, I know we wanted to give a shout out to Craig Roberts and the way they're navigating at Crystal Judson in Tacoma.
Thank you. Yes. And one of the things I want to say about Craig is that they started probably one of the very first, even before they opened up a Family Justice Center, one of those communities that was embracing technology early on and created kiosks throughout their county to have access to the court system, access to restraining orders. And that hasn't stopped them now, even after the Family Justice Center. So they are making good use of providing services remotely. I had a chance to take a look at his weekly report. And if you're not on his weekly newsletter, you should be, because it just inspires me on Fridays. But one of the things that he had in his last weekly report was a court order. And I went to the court order and looked at it and read through it. And what I realized that here's a gift. Even though this emergency protection order was issued in record-breaking time, talking about closing down the courts, what's going to be available, what's not going to be available for public safety, why can't we use that same court order across the United States to say victim safety, that technology is needed to enhance victim safety, to increase victim access to justice in so many different ways. So yes, we are hammering this particular issue. We're hammering on it for a reason. Timing is everything. And here's a good example of an order. We also wanted to share the next slide. Actually, you were going to talk about this one.
I just wanted to highlight.
I want to talk about this one. No, I want to talk about this one.
There's two ways to go about this issue, about getting protective orders extended, about addressing visitation issues. One would be a court order from the Chief Justice of the Supreme Court. Another might be legislation, emergency legislation from a state legislature. I know Melissa Earlbaum and the Clackamas Women's Services and the Family Justice Center there have been working on this, trying to make sure that even though they've gone virtual too, that they are still advocating for these orders to be extended. And I love the fact that Clackamas Women's Services and A Safe Place are working on developing a whole bunch of virtual things, virtual art-based therapy. They're doing their virtual morning staff huddles. I think we should call those hope huddles, and everybody in America should ask the question every day: where did you see hope today? Where do you see hope this week? Where did you see hope last week? They're also doing parent cafes virtually online. You can have a support group online. You can have people come together online. We just have to make sure we get them access, that they have safe access to online services, because there's lots of survivors that may not have access to a computer. So we need to think that one through. They are also advocating on this issue of video court, even though it's been paused. I think we keep pushing it, and we keep pushing electronics, and they're doing a lot with hotels. We're going to wrap up here just in a couple of minutes and take the questions before we're done. But we do see this as an opportunity to, as Gail said, to advocate for video conferencing with the courts, electronic filing, now more than ever. We've been doing it. We know it works. We know we can do it safely. Every survivor is going to be safer not having to be at the courthouse with her offender. There's just no doubt about that. And there's no reason that victims have to go to court ever in domestic violence except to testify in a criminal trial. That's about the only time that they really have to be in court, is testimony in a criminal trial. Everything else can be done remotely or electronically if we make it possible.
Casey, what I wanted to add to that was, early on, there was really a push for video conferencing. But I want to emphasize that, yes, that's important because you're used to seeing flags and you're used to seeing people, but there's no reason why we can't do this back. If you want to go back, you can still do fax filings, e-filings, phone calls. So this is a little bit of history, but we should be able to advance. And the next one is about advancing and how we can continue to provide those forensic exams for victims of domestic violence, assault, the children, and our strangulation victims. We know of a number of family justice centers that are doing it, but this, going to the next slide, is what about telemedicine? We're seeing telemedicine being utilized now before anybody goes to the hospital. I know my daughter has made good use of it with her kids, especially now. You don't want to go to the hospital at the time when everybody is on high alert, but we want to challenge ourselves, and we do have some contacts, and in future webinars that you will see from us, we're going to go deeper into telemedicine and make some new friends and new partnerships with the folks who are doing it now and doing it very well.
We just saw that in Chattanooga, they're actually using their telemedicine platform. The therapists are using it, and other partners as they're developing their family justice center model there and working through the partnership and all their allied agencies. And we do think that a HIPAA compliant telemedicine platform should be the future for all of us. In all of this that we're talking about, as far as virtual services, online services, electronic communications, I did want to highlight that the National Network to End Domestic Violence has a digital services toolkit. Cindy Southworth and the whole team at NNEDV have created a toolkit. I strongly encourage you all to read it, to have it accessible to anybody in your center that is involved in electronics. This is a really important piece to make sure we stay compliant with VAWA, to make sure that we use best practices in keeping survivors safe in this journey of figuring out how to provide things telephonically, electronically. So that toolkit is a great resource. And I'm going to wrap up, and then we'll take a few questions. Some of you know this slide. These are the guiding principles of Alliance for Hope International. We don't use the phrase trauma-informed. We use the phrase kind-heartedness. But remember in this journey that we still have to be guided by the principles that started us. We still have to be willing to try to be transformative. We still have to stay engaged. We still have to be focusing on what survivors want and need. We still have to be thoughtful about culturally responsive and culturally relevant services. Let's not forget the principles in the crisis. So many of us, I think, have been somewhat paralyzed in these moments of this journey. Now it's time to stop being paralyzed, and it's time to start moving forward. But as we move forward, let's not forget the guiding principles that caused us to become collaboratives, that caused us to become wraparound services models, because that's what still has to drive us. And as I close my comments and we take a few questions, just a couple of things. This is our research on hope, right out of Hope Rising. Hope is the ability to look into your future and imagine who you want to be and what you want to do, and then set goals to get there. That's what hope is. Anger is what happens when frustration and anger is what happens when you have goals, but you can't get there. Despair, there's a ton of despair right now. The murder-suicides of America are rage plus despair that are producing these murder-suicides that appear to have spiked. And then you get down to losing all hope. Despair is when you have goals, but you don't know how to get there. And apathy is when you just give up even setting goals. We've got to be able to, as advocates, especially working with victims, to articulate this. What they're going through is natural. The despair they're feeling is natural. But we've got to figure out how to get back to hope. And if you have read Hope Rising or seen any of Dr. Chan Hellman's research at the Hope Research Center at the University of Oklahoma, small little goals. That's why we all need small little goals. Today, I'm going to take a walk for 20 minutes. Today, I'm going to go hang that picture that I haven't hung for 6 months. Today, I'm going to do this. Little goals. Hope breeds hope. Okay, this is my goal for today. What do I have to do to get to that goal? We got to do the same things in our own lives so that we're doing with survivors. And we do have to, at times during the day, close our eyes and say, what will it feel like when this is over? What will it feel like when my life is healthy again? What will it feel like when I can be in relationships with people again? We've got to provide that process scientifically, COVID-19 science and the science of hope. And we talk in our work about force multipliers of trauma, childhood trauma, and polyvictimization, and so many things like that that get multiplied because of racism or poverty or bullying or other kinds of force multipliers. But I just wanted to talk about the force multipliers of healing that we've learned about in family justice centers. Community is a force multiplier. Survivors feeling like they belong to something. Survivors being given human voices, human faces, real connection, real kindness, the space to talk about their fears, not just what do you need right now, but how are you feeling? What's going on? How can I help you? Tell me about how your kids are doing. All of that is part of the force multiplying of what hope and healing looks like. So let's not forget those things. We know from the Full Frame Initiative that the well-being is about safety. It's about stability. It's about being good at something and being able to master some kind of skill. It's about social connectedness, and it's about meaningful access to services. That's our calling as advocates, as prosecutors, as police officers. We've got to stay true to that calling, even in the middle of all this. And we do believe family justice centers and child advocacy centers and rape crisis centers can still keep doing that kind of work. Domestic violence agencies are struggling to do that work as well, and we need to support them in that journey as well. I want to close my comments, and we may go a few minutes over here to take questions and answers, but I want to close my comments with a story that is just stunningly touching. Deb Greenwood just forwarded this to John Hamilton, our director of Camp Hope America, and John sent it on to our staff. The Center for Family Justice in Bridgeport runs our Camp Hope program there. They've done an amazing job over the last 4 years to develop a camping and mentoring program for children impacted by domestic violence. And Deb got a text message from a young man named Ethan. Ethan is a Camp Hope kid from Connecticut. He started going to camp 4 years ago as a freshman in high school. And Ethan sent a message to Deb, and he sent pictures with that message. And the first picture she got said this: "Hope is not canceled. We got this." The second picture he sent said, "We got this. Hashtag Camp Hope." And the third message he sent was this. And this is what Ethan's text message said: "Dear Deb, I wanted to let you know that I connected with Miss Sasha." Sasha is the director of Camp Hope, Connecticut. "I connected with Miss Sasha, and I've been able to go get food and take it to all my Camp Hope friends and their families. One of the things I'm really good at is being resourceful. I worked a lot of jobs in high school, cleaned kitchens and cleaned bathrooms. Now I know all the people who I'm giving food to, and they're all my friends. The little guys have now become the big guys. Everything else in the world is canceled, but not hope. They can't take away our hope, Deb. Our new mantra at the center needs to be, hope is not canceled. Please remind people they can't take hope away from us. Hope is not canceled. We got this. Love, Ethan." Ethan's a senior in high school now. He's missing out on his graduation. He's missing out on all the spring activities that a senior in high school would look forward to in their lives. And his response is, "We got this." That's the message. That's the power. Ethan, by the way, just found out he's getting a full ride to college last week for the fall. So I am so thankful for that message as we wrap up this webinar. Our calling through this pandemic has to be kind-heartedness, trauma-informed work, but hope-centered. What goals can we set? What can we control? What can we help survivors control? What can we offer to them? So I'm going to stop there. We'll take a few questions here that have come in the question feature. And I'll just read a few of them. Can you discuss remote coordination of partners since we're not on site right now? Also, how to assist partners and providers in connecting families to services. I think we've touched on a fair amount of that. I think we've got to get electronic platforms to survivors. So figure it out. We're going to reach out to Verizon and talk a little bit more about this, because survivors need to have remote access. So either we need to make sure they have a computer or access to a computer. In our Camp Hope program, we gave all of our kids across the country tablets 2 years ago. And those kids are now using those tablets to communicate with us and help their moms communicate and access services. So we have to figure out how to get some form of communication into the hands of survivors if they don't have online access, that's for sure. Child exchange, I think child exchange is a huge concern. Please talk to civil legal service attorneys about this, and we need to advocate for it. What we will do, we don't have time to get into this deeply. Gail and I have been looking at the apps that exist where you can do everything electronically with an exchange so that you don't have to have any personal contact. We're going to look deeper at those this next week and see if some of those apps, I know Texas is using a particular app. I know other states are using particular apps. But I also think we need to reach out to the courts and say, can we put a stop to child exchange if a victim is afraid to expose her kids to an abuser? I think we need to go to court and advocate. That's the job of lawyers, is to advocate for the safety of survivors. I got a question, Gail, from Candace Coolidge in Colorado. Does anyone have some language for their state stay-at-home order to include an exception for DV victims fleeing? We do, Candace. I will send you the language from a couple of states. Just email me at casey@allianceforhope.com, and I'll send you that information. Here's a question from Nicole Helmer. Last Thursday, we had a couple, female age 21 and male age 24, shot and killed. There hasn't been anything on it in the news, with one reporter saying online that the state police are calling it a double suicide. What are the odds that it's a double suicide versus a murder-suicide? The couple was not known to our DV program or high-risk team. Well, I'll make a comment and see if Gail wants to make a comment. I don't know the answer to that, but I will tell you that there are a lot of staged situations where they make it look like it's a suicide when the victim didn't really commit suicide. So I understand that framing, but I will tell you that one of the programs we have is we investigate cases like this for families or for agencies, make Public Records Act requests for information. I think double suicides, especially of people that young, is very unusual, unless they were severely immunocompromised and COVID-19 positive or had other major issues. That would be highly unusual to have a double suicide at that age. Gail?
Well, I would say right now, obviously law enforcement and our medical community and a lot of communities are overwhelmed and understaffed. So I do think it's going to be up to us to keep that case alive, to keep talking about it, to keep analyzing. I was talking to an advocate from New York, Amy, and she was mentioning a couple of things that do happen at family justice centers. They have a high-risk team there. They are seeing domestic violence homicides from victims that never step foot in a family justice center. And Casey has been tracking this as well. And one of the things that we found in San Diego, as we opened up our doors and put a lot of things into place, many victims of domestic violence don't know about family justice centers or even the programs that are available to them. And this awareness issue, I think, is going to be more important than ever. Embracing and reaching out to the media. We most recently put out a new media guide on strangulation, but it's still a very good tool for you. And we also think that as we continue to do fatality reviews, that we have to review these murder-suicides, and we think in particular suicides, because we do believe that a lot of cases are staged suicides. And very often law enforcement may come in believing that it is a suicide, and essentially there are two different investigations. But it is up to us, the advocates, the family members, professionals, to keep raising the alarm and insisting that there is an autopsy. Because when we talk to our medical examiner here, There are about 20,000 deaths every single year in the county of San Diego, but only 3,000 of those cases get referred to our medical examiner to do an autopsy. And the only way it gets to him is that if somebody rings the bell, throws a flag on the field, and says that this is a suspicious death. So thank you for raising it. And I'd say please keep raising it, and please try to advocate for more cases being reviewed by your fatality review team.
There's a number of comments and questions about the CARES Act. James Smith said the recovery tax rebates in the CARES Act presents a great opportunity for victims and survivors, but also presents a minefield of potential problems, hazards, and burdens to actually receiving the funds, at least in a timely manner. What are people doing to protectively, or I think proactively, to identify the issues, to address the issues of commingled or stale accounts for direct deposit and mailing addresses, and to effect remedies? I don't know the answer to that question, but we will be storing these Q&As, and we'll be putting them out to all of our folks so you can provide answers, James. I do know that we have to get up to speed, and there's not much out there. I just went and read everything I could find yesterday, and there's lots of people just beginning to think about all of this. So I think we have to just keep focusing and working on that. We got a question here, Gail, and I don't know if this is even possible. What are the digital options for notarizing protective order petitions online? I don't know the answer. I do know that when you go through the Bexar County system, that it's all taken care of inside that system. So I don't know about digital notary services, and very few states require notarization of things. So I'm not sure, Kim, what state you're from, but
this is probably a good research project for one of my law students as I start that class this summer. But this is also an area where we can change these laws that were in place hundreds of years ago and have never been updated. I mean, why do you still need a notary on a lot of different documents? And especially now, my son and daughter needed to get a notary, and that's a scary thing. How do you do that? How do you know you're safe? And who's going to be available? Who's going to provide those services? So lots of issues there. I would agree. Don't have a good answer without thinking it through and doing some more research, but we will add this to the list, and we appreciate all these, especially the difficult questions that our team can embrace.
A lot of people have asked about the online access, how to do it. Some courts are fully open. I'm looking at the Q&A, Gail. Some courts are fully open and some are fully closed. Boy, if you're in a county where the courts have completely shut down, you need to reach out to your Supreme Court. I just can't fathom the court shutting down completely. The civil court services are essential services in every state in the nation under lockdown orders. So I am stunned by it that there would be any court that would completely shut down. I have gotten some questions about Hope Rising. Yes, Kim Garrett asked about whether or not I would provide Hope Rising in a digital format for free to give to survivors. Yes, I have an electronic copy of it from our publisher. We own the rights to it. Yes, Kim, I am willing to provide Hope Rising in the digital format for free. There's a Kindle version that's very inexpensive as well. I tried to see if I get our publisher to take that down to nothing. They wouldn't do it. But yes, I do have an electronic copy, and legally, I think I can. Let me check with the publisher, but I think I can provide it individually to survivors. It's a good read. And the children's book as well, we're going to come up with a way that you can get that at cost, which is about $3 plus shipping, because I think every child in America needs that kind of lullaby book at night. They all need some way to comfort themselves and self-soothe. And we know the Camp Hope Goodnight song does that, but we also know that we can do that with telling them stories. There are others that we're not going to be able to get to, talking a little bit about, let me take one more, Gail, and then we'll wrap up. This is from Sarah Fisher. I'm the only victim advocate on a reservation, and our tribal judge is releasing domestic violence suspects because he doesn't want them to catch COVID-19 in the jails. This caused me a lot of issues having to relocate my victims because now their abuser has just been released. I tried explaining this to our judge, but his mind was made up. So now as a field worker, hands-on, I have COVID-19 and I am quarantined at home, very sick. I'm scared for my victims as I am the only advocate. Anyone have any insight or ideas? Sarah, you are in our thoughts and prayers. Blessings on you. Please be safe and take care of yourself. If you need to go get medical help, please go get it. I'm so sorry to read this. I will tell you that we will follow up with you. If you want to send us an email, we'll provide direct support with you. Just email, you can email me personally at casey@allianceforhope.com, and we'll help you. We'll help you do whatever you can to get what you need and try to advocate for survivors. So please just email us directly.
I would think hotlines. This is the time for the hotline calls to stay connected in some way.
Yeah, 1-800-799-SAFE. Make sure you connect advocates. Connect victims to the hotline for sure. Without a doubt, that's a high priority. Friends, we are just a little past 10 o'clock. We were aiming for an hour and a half, and we have come to the end of that. I apologize that we weren't able to answer all the questions, but I do appreciate the work that you're all doing every day. Gail and I both feel very strongly that we want to do everything we can as an organization to support and encourage each of you. And Gail, I'll let you make a comment and we'll wrap this up.
Well, I started by saying I was really glad to have this call because I miss all of you. And I do think this is the time where we all need to stick together for victims of domestic violence and seize this opportunity and see the gifts where we see them, to change some laws, to continue to advocate. Clearly, they need us now more than ever. I feel that isolation for them.
We all feel it. If you want to, we're going to be doing regular announcements through our mailing list and sending out examples in the weeks to come of creative ideas from programs and agencies all over the United States. All you have to do is text the word Hope Giver to 22828. You put 22828 in as your phone number, as the phone number basically in the to box on a text message, and then inside the text box you type Hope Giver. It's a double-blind opt-in system, so you'll get an email from us allowing you to join our mailing list and stay in touch with us. You can stay in touch with us on Facebook as well, either at Alliance for Hope International or Family Justice Center Alliance. Camp Hope America also has a Facebook page. We love and appreciate you all. We consider it a high honor to be able to try to share some information. Hope over fear. Hope over fear. Hope is greater than fear. That's the message that we leave you with today. God bless you all. Thank you for letting us share on behalf of our whole team at the Alliance. Be safe. Take care of each other.